We have our guest in our studio today to talk about the Zika virus, and we're very privileged to have Dr. Richard Van Enk from Bronson Hospital. And these types of diseases, good morning to you, Doctor. It's nice to have you here today.
Good morning. Thanks for inviting me.
Definitely in your wheelhouse, your area of expertise, these viruses. And this is, I want to say it came out of nowhere, but I think we've known about it over a year now. Or almost a year?
It's been known for a long time, probably 40 or 50 years. This virus was relatively well studied in Africa. The term Zika refers to an area of Uganda, and so it was known to exist in primates in that area of Africa, and it looks like now that it's spreading around the world. So it's a well-known virus that seems to be changing.
I didn't realize that. I thought it was originated in South America, where it's predominantly being noticed right now.
It was not. It looks like it was imported to South America from Africa, and people, of course, are trying to find out, what the first case was and when did it hit South America, because it's a very interesting thing. And microbiologists like to study that sort of thing and try to go back and recreate what happened and what the story was.
It's scaring the daylights out of us because we see the birth defects that have resulted from this virus among, as a result of pregnant women contracting it, and that their children have a particular deformity. The disease itself, before we get into that, not all that terrible.
It is not. It's a fairly mild disease, and most people who are infected with this virus don't know that they've been infected. They might be a little tired, have a headache or something, and that's all. So it's really some of the things that just kind of fade into the background. When you travel internationally, you're always kind of tired, and so it could be that you've actually had the Zika virus infection and didn't know it. It looks like about 80% of people that have it never realized it. It was so mild. 20% seem to have a more severe case with headache and severe muscle aches and things like that. So they might seek medical attention, but the majority of cases are relatively mild.
And, we hear it spread through mosquitoes. So we're thinking, okay, well, hopefully mosquitoes aren't going to fly up here in Michigan. They wouldn't find it too hospitable right now. But I guess there's a pretty good opportunity for those insects to get into the southern portions of our country.
That is true. The species of mosquito that this virus lives in does exist in the southern United States. Right now, people are looking at across the Gulf, so Florida, Alabama, Mississippi, and Texas. Those are all areas where the species that of mosquito that could carry this virus does live. And so if this virus ever entered the southern United States, we could have cases occur here that did not originate in South America.
And I saw a map that it showed Mexico as being, a country that does have the insects and the virus. So, it'd be very easy for that to get into southern Texas and
Absolutely.
Go from there.
Yeah.
But now, are the bugs the only way that it spreads?
At this point, the primary way that this virus spreads to humans is through the bite of a particular species of mosquito called Aedes aegypti. And that's the primary way. It's possible that it could be transmitted otherwise. For instance, if you were sick and you donated blood, then the virus could be in your blood. So situations like that, it's unlikely that it could be spread person to person, but it's perhaps not impossible. It's a group of viruses that we call hemorrhagic viruses. That is, they interrupt the blood's ability to clot, and so you tend to have a little bit of blood in your secretions.
No.
And so it's theoretically possible that there could be enough virus in your secretions to transmit it to another person, but of course we don't know that yet. It's very early in the study of this virus, and so a lot of questions are unanswered right now, and we hope to have the answers soon.
Now, I know we've had cases in the United States, but these are people who have come from these regions at risk, South America and the like, and they've come up here and they've been diagnosed with the virus. Is there a chance they could spread it to another person?
It is possible. They're saying that for about 7 days after you've had your symptoms, you could still have virus in your body. Until your immune system kills all those viruses, it's possible that you could have that virus in your body for several days. So they're advising these people to be careful and not to do certain things. Don't donate blood, for instance, things like that.
My goodness. And you were telling me before we went on the air, there was one very odd, isolated case where it was, transmitted sexually?
It's possible. It looks like that picture it fits. We have a person. There is a study that was recently reported on where an individual came back from an endemic area and had the Zika virus infection and was intimate with a partner, and the partner became sick with Zika virus. So we don't know how they got it, but it's plausible. It's theoretically possible that the virus could have been transmitted through that encounter, and so that raises all sorts of additional questions about the virus and how it spread in its natural environment.
It's still pretty young in the study, even though, as you mentioned, it's been in Africa for a few years, but I mean, are there researchers actively trying to figure out some sort of a antivirus for this?
There's always virologists looking at viruses, but Zika was not very interesting until recently, and so the resources that were put on this virus are distributed across all the different viral threats, and so of course recently a lot of resources have been put into Ebola virus, and so the Zika people were kind of ignored, and now they're the stars, they're the rock stars of science, and so everyone is looking at them and following them. So we should have a lot more information about Zika soon as these people increase their studies and get more funding and answer all of these questions.
And of course, that's all being pushed to the forefront because of the birth defects that we have heard about on the news. When we come back, I want to ask you more about that and about pregnancy risks and what pregnant women should know about the Zika virus. Dr. Richard Van Enk of Bronson Hospital is our guest here on WBCK, and we'll be back in just a few minutes. Dr. Richard Van Enk, he is the Director of Infection Prevention and Epidemiology at Bronson Hospital, is our guest as we talk about the Zika virus. We're encouraged by the fact it's not that big of a virus, as viruses go, except the pictures we've seen of the children down in South America now who have been born with horrific birth defects. What's the prevalence of that? I mean, if a woman has this Zika virus and is pregnant, is she going to have a child with a birth defect?
That's a difficult question to answer right now. There's a lot of people looking at that. This connection with the virus and these birth defects is new, and we're not really sure whether we're just seeing it more often, whether the virus has changed, and that it really is a new phenomenon. It's not that unusual for certain viruses to cause birth defects. German measles, for instance, will cause these kinds of birth defects, and there are other viruses that can do that. So that's why we're very careful when a patient is pregnant that they're all up to date on all their immunizations, and we're very careful about that to protect them against some of these infections. But this virus seems to be new, this association. At this point, we don't know exactly how the virus causes this. It damages the brain in some way. We don't know how, but a lot of people are working on that, and we should have some answers.
Microencephaly, not only brain damage, but the head is shaped differently.
That's true. During the development of the fetus, the skull basically expands with the brain. And so when the brain doesn't develop, then the baby's head is smaller than normal. That's called microcephaly. And there are a number of different things that can cause that: chemicals, toxins, alcohol. We talk about this syndrome called the fetal alcohol syndrome, where if a woman drinks a lot during pregnancy, that can cause this condition. So a lot of things can cause this condition, but the association with this particular virus is new.
I see. Let's say a woman in the United States is pregnant and they have a trip planned to Brazil, and of course the Olympics is going to be down there this year. What do you advise them?
That's a very good question. At this point, the CDC does have a travel advisory for those areas where this virus has been found, and they're saying that if you're pregnant, you should consider not going. And so it's a risk-benefit calculation that you have to make. If you really feel like you absolutely have to go, then there are ways to keep safe. It's mainly an issue of protecting yourselves against mosquitoes. If you are not bitten by a mosquito, it's very unlikely that you're going to get Zika virus. So it basically is mosquito protection. If you have a choice to go or not, this might not be a good time to go to that particular area. Maybe postpone it, go a different time, or send somebody else if it's a business project.
Well, of course, we have mosquito repellent sprays. And I guess if I were pregnant and heading to South America, and I'd be like doing the double spray. I'd be like, hey, get my backside. I'd like, well, here, fill up the bathtub with this stuff. But I mean, is it dangerous for a pregnant woman?
It really isn't. All of the mosquito repellents that are sold in the United States and approved by the FDA are safe in pregnancy. So there's no real danger. But as you pointed out, they have to be applied correctly, and a lot of people don't apply them correctly. And so there's a particular way to put them on, and a frequency of reapplication. And how to treat your clothing and how to use them in relationship to sunscreen. And so it's more complicated than a lot of people thought that it was.
Sure.
And it's good to learn how to use these mosquito repellents because now it's very important. It's not just a mosquito bite. It could be a more serious thing.
And not a lot of margin for error. I mean, all it would take is one mosquito bite to get through, and if that mosquito was carrying the virus, you could well get infected.
That's correct.
Would you definitely get infected?
Probably not. It looks like most of the people that are exposed do not get infected. We don't know exactly why. We don't know whether pregnant people are more susceptible to infection. Maybe. So we just don't know the answers to all those questions yet.
We have a lot to study on this virus, don't we?
Yes.
Let's say a woman is bitten by a mosquito and does get the virus. And then, can she get pregnant years later, months later, and be okay, or does she have to worry for life?
It looks like the virus is pretty much eliminated from your body after several days after the infection. So it's not what we would call a persistent virus. It doesn't form a latent phase like some other viruses do. It doesn't stay in your body. So after you come back, when your symptoms are gone, after a few days, it looks like you're completely clear of that virus and you never have to worry about it. And it looks also like you're immune to that virus, and so you would never are unlikely to get reinfected after you've had your first infection.
Okay, well, as a novice then to this whole area, I'm thinking to myself, if that's true, then they ought to be able to develop a vaccine.
Absolutely. There are a lot of people working on vaccines. It's possible that this virus could be susceptible to an antiviral agent. So we just don't know yet because there was no incentive to look at Zika virus. It was not a problem until recently. So there just aren't any vaccines near development, and there's no antiviral agents. But there's a lot of people looking at that right now. And I would say, in several months or a year or so, we should have some good answers in terms of what will kill the virus and then a potential vaccine that will prevent the infection.
Hopefully by the time it gets up here, because I've seen a couple of people interviewed about this, and of course the question is always, are we going to get it up here? And they're like, well, yeah, probably, eventually.
It could happen, absolutely. I mean, there's a lot of analogies if you look at what happened with West Nile virus. It came to the United States, new, we'd never seen it before. It crossed the United States in about 4 years, started on the East Coast, moved across from east to west, got to California, and then it sort of died out. And now we don't see really West Nile virus anymore. So this could be the same thing. We get a wave of infections, and then it goes away. That's basically the story of microbial ecology. Things come and go, and you don't know why they come, and you don't know why they go.
Dr. Richard Van Enk is the Director of Infection Prevention and Epidemiology at Bronson Hospital. When we come back, I just want to ask you quickly about this year's flu vaccinations, and we'll wrap it up in just a couple of minutes. Dr. Richard Van Enk from Bronson Hospital is with us. He's an expert on viruses and disease prevention and epidemiology, as they call it. What about our flu vaccine this year? Last year they didn't do too well. As what I got from it was, well, they kind of gamble on what they think is going to be the prominent flu virus, and they don't always hit it.
That's right. Every flu vaccine season is a bit of a risk. They take the prevalent viruses from the end of the previous year and they make the vaccine from those. And they assume that those will be the same viruses in the next year. And sometimes they're correct and sometimes they're not. Last year was not a particularly good year for the flu vaccine. This year, it looks like it's going to be a very good year. It looks like the vaccine is protecting us against the viruses this year very well.
Does weather have anything to do with this? I mean, we haven't had a very tough winter. People haven't been, stuck inside. They probably get out, get a little more fresh air, move around a little more. Does that help?
I think that there are people that have looked at that. I don't know that it's so much temperature. The studies that try to relate atmospheric conditions to influenza virus say that it has more to do with humidity. So the drier the air, then perhaps the more the virus, the longer the virus can survive. Or I don't know that it's temperature. It's probably related to human behavior because the closer people are together, the more likely they are to transmit infection. But I don't think it's so much temperature as perhaps humidity.
I had heard that too, so I think having a working humidifier in your home, either whether it's part of your furnace or one of the standalone jobs, probably a good thing to have.
Probably, yeah.
Well, Doctor, thank you very much for stopping in today. Learned a lot about the Zika virus. Let's hope we don't have to learn too much more before the researchers learn what they need to know to protect us.
All right. Thanks for inviting me.